How you doing? This is Toki from Medical, elbow dislocation simulator. We're gonna have first exhibit opportunity after all this mess in Tennessee. So there's a sports medicine conference in Tennessee, and I don't know, I'm not sure if you're going, and please visit booth by Sawbones. They're gonna have elbow dislocation later and also the shoulder dislocation later. Okay. Today I'm trying to explain or give you an idea how you can use this in a classroom for athletic training program if you for the clinical skill class. Okay. First, I'm assuming all those students, they come to a clinical skill class, they took anatomy and physiology, so they should have basic anatomy knowledge. Show them the x-ray of AP and lateral when it's dislocated and not dislocated. Okay, I have the picture, so. Okay, and then you need to let them practice. Okay, they don't need to know how to dislocate. That's clinical instructor's job. I got a couple complaining feedback for shoulder dislocation later because students, they're having a hard time to dislocate. They don't need to know they don't need to know how to dislocate. That's clinical professor's job. Student, they need to know how to reduce it. Okay. Yes, it's hard to dislocate. It's supposed to be. Okay, for shoulder wise. Okay, so if you're having a hard time, make it the easiest setting. Okay, and then dislocate, and then after that you make it harder. Okay, you could do that. So the same thing on this one too. You know, both models are adjustable. Okay, so if you're having a hard time, dislocate, make it easiest setting, and then dislocate, and then make it harder. Okay, you can do that. Okay. There are two techniques I see and I use. One technique I used twice was this solo technique because I didn't have a doctor on site. You know, I work for high school setting, so I didn't have an assistant. So I had to come up my own way, solo technique, which this is the technique I came up with, and it worked. Okay. So I did that. This is like a patient, student one was on the ground, and I did that on the spot, and also one was already came off the field and on sitting the bench. So I did that. Okay. Again, since I had a body strength, I did that. But if you don't have body strength, let's say, or depends on the situation. Let's say you're 80-pound athletic trainer, and then you see 250-pound football player dislocated elbow. And you do the steps to check everything, and then you have to reduce it. Then, you know, so it depends on the situation. You know, it depends on the doctor you work with, depends on the institution you work for, and it depends on the state. It depends on the situation. But you know, if you have to do it, you wanna know how to do it, I would, you know, so that's one of the reasons I came up with. I want to get better. You know, if we get to the situation, I don't want to fool, you know, I don't want to show, I don't know what am I doing. So, again, one is the, you know, solo technique, or another one is the, you know, patient face down. I cannot do the reduction right now, so I will show you in another video.
Ouch.
So you can do that. That could be useful technique for the people they don't have body strength, and then you encounter massive athlete and you do not, and you can just focus on, you can ask somebody to hold it, this part, and then you can focus on traction. Okay. Is it, you know, does it go back in 100%? There's no guarantee. Okay. I worked for high school setting for 20 years, and I could not make one. You know, one which was not my athlete. You know, I got a phone call after the fact, about maybe 30 minutes later, and I got, you know, and then get to the situation, and it didn't go back in. It was so hard. So, but you know, it's sooner reduce, it's easier to put it back in. Sooner reduce, patient, you know, suffer less pain. Sooner reduce, faster recovery. So sooner the better. I'm not encouraging you to skip X-ray to reduce. I'm never ever said that. But do I reduce it without X-ray? Yes, I do. Okay, like I work for high school setting. I don't have X-ray access. Okay, so but I use steps before I reduce. Okay, so I have another another video for that. So you want to watch, please check it out. And you know, then you reduce. After you know, student get used to that, then I use this simple sleeve, okay, to cover the area, okay. Okay, and then give them a situation, what happened, okay, and then what would you do? And then, you know, as the, you know, clinical professor, you have the sheet, you know, the paper, and it's just checklist, you know, what would you do? And then you can kind of test them skills. And then if you have to reduce it, when would you do it, and how will you do it, you know? Boom, and I guess I passed it, you know. So that's how I recommend to use this model. You know, I think it's very useful, this simple sleeve. And also, really, you can feel how it's go back in. I mean, it's as many as you want. So it's $1,500 plus shipping costs. So you can place order through manufacturer Sawbones. Please contact info@sawbones.com. Info@sawbones.com. They can give you a quote, and also they can give you a link to pay directly. Depends on you might do the PO, or you might pay directly company credit card, but they can take that. So if you have any different technique you know and you use, please share with me. I'm curious. I saw one other technique. I made a YouTube, also TikTok, which I don't think I will use that, but I just made a video. So thank you. Please subscribe and support my channel. So thank you. Bye.